Hello, this is Dr. Do again. This video is on alphabetic list of problems on a letter H. Today I'm going to talk about hyper and hypothyroidism. I think I probably briefly previously mentioned these two diseases, but I'll just, if I did, I'll just put a review and put everything together. Before I talk about this hyperthyroidism, is there any emergency situation associated with this hyperthyroidism? Yes, if the hyperthyroidism is associated with the hypothyroid crisis, which is very critical, very serious, the presentation as the patient may know or not know had a previous history of hyperthyroidism. So the thyroid hormone circulating in the blood reaching very high level in short time, causing blood pressure elevated about 180 about 200, heart rate very fast. The patient feel flushing, and it is a very emergency situation. Could be life-threatening because of the heart rate, the palpitation, and the high blood pressure, particularly the blood pressure is elevated to very, very high. So that is the emergency situation. If you had, or if you know you had hypothyroidism, I'm sure your physician already told you what kind of signs to look for this kind of emergency situation. Then you need to see the physician, call your physician, or go to the emergency room right away to lose the blood pressure, decrease the serious complications. One of it will be the stroke, hemorrhage in the brain. So, and can you manage this hypothyroidism at home? By saying that, which means you, without seeing physician, without medication? No, I think you have to, this disease has to be managed by the physician, either medically or surgically. So, before I talk about the hypothyroidism or hypothyroidism, let's just briefly review what is the organ thyroid. Thyroid is located at the center of cervical area, anterior cervical neck area, on top, actually in front of the trachea, and it's an endocrine organ secreting the hormone of thyroid hormone, and regulated by the pituitary gland and the above level of hypothalamus. So this is about the another endocrine axis, so hypothyroidism. So the hypothyroidism is either from pituitary secreting too much TSH, thyroid hormone stimulating hormone, or the thyroid itself undergoing overacting, secrete more thyroid hormone. So this is the cause of hypothyroidism. Usually it's also could be the immune cause, or just the hypertrophy of local focal area inside of the gland, adenoma, for example, just overgrow of this glandular tissue, so then carry on the same function as normal cells, so then raise the thyroid hormone. Or the immune cause, which means the antibody bind to the receptor located in the thyroid gland, and mimic the function of TSH. It's like the thyroid gland receiving the stimulus message all the time, so keep secreting this thyroid hormone. So these are the causes. Or there's another actually inflammation, which causes transient hypothyroidism, because the viral infection, the thyroid mistaken, or the thyroid cells was broken, undergoing inflammation, and release a huge amount of the hormone in short time, and followed by the hypothyroidism. So if that's the case, then usually feel the pain and the inflammation, and it's a transient, and it could be immune or viral cause. So basically, this is just the summary of the causes. In terms of for you as a patient, what kind of signs you're looking for this hypothyroidism? Feel eating more because thyroid hormone, the function of thyroid hormone is to increase metabolism, provide extra energy, at the same time lose weight, eating a lot but still feel hungry, and heart rate is elevated, beating very fast, and temperature is high, you feel warm all the time, and flushing and sweating. And also if you close your eyes, stretch your arm out like this, and your hands might shaking, you can ask your family to do this. You can raise your hand like that and put a piece of paper on it, close your eyes, see whether the paper is shaking with your hands. So that's kind of one of a sign to look for whether there's this tremor caused by elevated thyroid hormone. So these are the presentations. So basically increase metabolism, heart rate, and blood pressure, and feel flushing, sweating, elevated, feel warm all the time, and lose weight. And if in the later stage your eyes can really pop out, increase the diameter, horizontal diameter from the front to posterior, anterior posterior lens is increased. So this is the symptoms of the signs, and then if you have this, you really need to see your physician to get it checked. And in terms of diagnosis, it's very straightforward. Do the blood test for the hormone, which is the thyroid hormone stability hormone, TSH, or do the imaging study to scan your cervical or neck area with or without radioactive chemicals to detach whether there is a overproduction of thyroid hormone. So this is and in terms of treatment, of course, either surgical if there is some overgrowth or the adenoma need to be removed and surgical, or use the iodine 131 which is the radiation therapy, and also or use medication to quench those hyperactive thyroid gland. So this is basically about hyperthyroidism. It could occur in young or old people, or like I said, probably after the viral infection, or probably without any cause or subtle, just suddenly develop this kind of symptoms. If that's the case, and don't forget to go to your physician to check it. And the diagnosis is not difficult, the treatment is not very difficult. So just need to identify those symptoms and see your physician to get diagnosed and treated. So I'm going to stop here for today, and thank you for watching. I will see you next time.